to know what are the misconceptions when of being a of the stream urology.
Okay. So, as we all know, urology is a branch of medical science that deals with the function as well as structural problems. So, in the urinary tract, so from the kidneys to the urinary bladder as well as the urine passages, most of the diseases are managed by the urologist. So, the advantage a urologist has is that he treats patients whose kidneys are predominantly healthy. And today being a prelude to the World Kidney Day, we can safely say that once the patient has a kidney failure or kidney issues, then only he meets the nephrologist. So actually, the urologist has a lot of responsibility in keeping the kidneys healthy, because once it gets damaged, then we cannot sometimes rectify it also. So, usual misconceptions about urinary disease are predominantly prejudices, especially with regard to the various diets that we consume, as well as the amount of fluid that you take, drinking a lot of water at one go, and sometimes taking medicines also. We don't bother many times to have an idea of what the medicine exactly contains, who's giving it, and whether it has got any side effects also. Apart from the effect, these days many people are very much aware on the side effect profile. So all these things has to be clear, because I'm speaking very broadly on a general sense, so that people are able to connect to it. So these are some simple things which if we are aware and follow certain basic rules, then we will not endanger our kidneys in the future.
Okay, thank you so much for that. And so when it comes to the warning bells, when can we contact our doctors about it? Like, what are the warnings that we should not ignore, or we should, we shouldn't overthink also. There are these small warnings, the small stuff, and there's a big warning. So which ones should we keep in mind, and which ones should we, it's okay to ignore?
Yeah, see, any problem, first there are always, ours being a very culturally rich and a traditional country, we have a lot of home remedies and small cures for many problems. So first thing, whenever a person has a problem with respect to the urination, the automatic home advice would be to sort of increase fluids or foods with a lot of water content, and then sometimes they have some home made potions which they sometimes suggest. So alarm symptoms, especially ones we should never neglect, are those that are causing any sort of bleeding in the urine. This is always a very panic symptom for the patient as the person, and also an important symptom for the doctor to investigate. So blood in the urine should never be neglected. Passing urine in very small quantities and very frequently, sometimes not even a good flow of urine will be there. So people keep going to the restroom frequently, and they pass urine in very small quantities and sometimes even in drops. So that is again an important symptom, which may be an early marker of some decrease in the urine output, kidney problem, or sometimes a urinary obstruction also. And then excessive weight gain, both the generalized body weight gain, and sometimes you have swelling in the legs, around the eyes. So all these things, along with uncontrolled blood pressure, these are all some of the important findings that immediately require a referral to either a urologist or a nephrologist, some kidney specialist. On the other hand, minor symptoms, sometimes you have aches in the urinary passages because of the dehydration. Sometimes strenuous exercise, travel may produce a little bit of burning sensation in the urinary pathways. So all those minor symptoms, they can always be attended to based on how they respond to the immediate remedies, or even the local practitioners can sometimes manage it.
So, which are the factors that would be where which are the cases where kidney transplantation would be required? Also, when it comes to donating your kidney, what are the criteria that should be followed?
Yes. Uh, See, our country has specific laws for the entire process of transplantation. Previously, there were a lot of loopholes which were being exploited. So, the Organ Transplantation Act has become more and more stringent. So, we have certain specific sets of rules which has to be followed before a transplant goes through. So patients who are kidney diagnosed with end stage renal disease, that means their kidneys are functioning very poorly, and their glomerular filtration, that is one value that we have, the GFR, that's what we call it, it should be less than 15 ml per minute. That is criteria to classify as a end stage renal disease. So patients with this end stage renal disease, if they are young, medically fit, they can be offered the option of organ transplantation, that is a kidney transplantation. So most commonly, the persons who come forward to give the kidneys are commonly the mothers. If the son is a young person, his mother gives, or if he's married, sometimes his wife comes forward to give, or sometimes the father also donates the kidneys. Beyond this, in our cultural realm, we don't have extended donor. So if the person doesn't have any living donor available, then he has the option of choosing a cadaver or somebody who is brain dead, whose organs are being harvested. So he can waitlist himself in the cadaver pool, and whenever the organ becomes available, he can get himself transplanted. So to donate a kidney also, there are age restrictions. So there should be a legal age for consent. So patients or donors should be above 18 years of age, and they usually patients with elderly people, they themselves may have medical conditions, and sometimes their kidneys themselves may not be very good condition. So we don't take patients whose age is above 50 as donors. So sometimes a 60 or 70-year-old man wants to donate his kidney, but we are not very keen, because when you fit it into a younger person, it needs to function for another 40-50 years, which it may not. So always elderly people we don't choose as donors unless there is a no other choice. Ideally, a living donor is the best. If there is a sibling, because they are very much cross, they something called as a cross matching. So they are basically each tissue in this person's body, the recipient should match with the donor. So if it is a brother and a sister, or somebody who is twins, so that means they have got a 100% match. So usually the kidney does not get rejected. So success of the operation is higher. So living donor is the better. If you don't have a living donor available, we can choose a cadaver donor. And in the cadaver, the problem is wait list. Some states in our country are performing very well in organ transplantation, for example, Tamil Nadu. So we actually have a large availability of these cadaver organs. Whereas in some other states where the awareness is low, then we may not be able to get the brain dead donors. So the idea is to create more awareness. More people should come forward to donate the organs, and only then we can meet the needs for getting so many kidneys in the recipients. Otherwise, they are doing their hemodialysis 2 times or 3 times a week, lifelong, which is both the financial burden, medically also sometimes they don't keep up well, and mentally also they are not in a great frame of mind. So transplant gives a big change to this set of people.
So, coming to the treatment plans, how would, for a treatment for a man would differ from to a treatment of a woman? Because they both have, because obviously they both have different symptoms and everything. So I'd just like to get, for example, a kidney stone.
Yes.
Like how would the treatment differ, and what are the ways to look at it better, future prevention in that manner?
Okay. So, okay, you are basically referring to the difference in the gender based on the what difference we do have in terms of treatment. And when you look at it, see, we just crossed the Women's Day. Okay, so all men and women are supposed to be equal. If not, women are actually better in my context. So we don't have any second thought on that. But as you see, our country, the structure, social structure, as well as the economic structure has always not been very friendly towards women. So what happens is a little bit of neglect always creeps in when it's pertaining to a woman or a girl whenever they are looking for any treatment options. So, for example, stone disease is very common, but luckily, stone disease itself chooses men more frequently than women. But nowadays, because of diabetes, obesity, and also the aging population, sometimes we are getting stones in the elderly age people. So whenever it comes to a woman with stone disease, the options, surgery, guidelines, they don't differentiate between man and woman. They just look at the size of the stone, function of the kidney, where the stone is blocked to choose the treatment. But in our society strata, what we do is generally we start them on painkillers. Some general doctor will give them painkiller. then they will go to another doctor. So once they start the process, they just keep waiting, hoping sometimes for the stone to dissolve, take a lot of natural remedies also. And there are a lot of other fields of medicine which say that they can cure the stones. So sometimes patient is attracted towards those options, and he starts following those treatments. Basically, the English system of medicine, especially surgical streams, are sometimes expensive. So a procedure to clear the stone may cost a little more. So being a lady, they generally are a little more sort of tighter on the purse. They don't want to spend too much onto the treatment because they want to save money for the family, and whatever happens, we will manage. This type of attitude many times we have, but that actually puts the kidneys at a greater risk. That's what I'm telling. Stone disease is one of the most common preventable cause of kidney failure in our country, in a developing country for that matter. So by treating these stones in a timely fashion, you can actually save a lot of kidneys, reduce a substantial proportion of patients who go to renal failure. And women should definitely be treated at par, and all facilities are available these days. The government itself is coming up with a lot of plans, a lot of programs which enable even economically weaker sections to take go to the good hospitals and seek the treatment.
So you're talking about what the government is doing right now, but is there any additions that you would feel that the government should do when it comes to women health, and how women should take care of themselves, and how their health should improve?
Yes, yes, definitely. We should have more awareness basically in terms of doing some master health checkups, and increasing the healthcare coverage, especially for the economically underprivileged. So people nowadays, the children are well settled, so they take good care of their parents many times. So they proactively go engage in some master health checkups, or even if there is a small abnormality found in any test, they immediately consult the specialist to clarify it, seek further treatment. Whereas those who are not economically well, what they do is whenever they have a problem, they try for some local remedies to settle the problem, not investigate and go beyond it. So, as the healthcare level, the government sector, few things that they can do is also extend the OPD timing, because population is very large. We are having only 2 or 3 hour OPD timing, wherein we can't cater the entire population. So we need to increase the timings, sometimes have some evening clinics, because people who are working cannot come in the morning. A day's work is lost. So for them, one day's pay is cut, which means they can't feed them for that particular day. And they are not very wealthy and they don't have a lot of backup. So in that situation, we can conduct some evening clinics, say 5 to 7, even in the government centers, health centers. In that way, that will actually encourage more homemakers to come and seek the medical advice. And also introduce these government welfare schemes in all the other private hospitals also. I am a very strong believer that health and education should be state controlled, and minimal private participation is must, because technology is sometimes very expensive. But there should be a lot of schemes so that people are able to get their treatment even in the good hospitals using the schemes and not having to pay a lot of money to their pocket. So more involvement of private sector, implementation of government schemes in the private sector also, and evening clinics for allowing the elderly, as well as, because you need to bring your aged father or mother to the doctor. You are working in the day, so evening only is the time when you are free. So that helps to bring a lot of population to bring themselves into the medical realm and get themselves tested and treated.
So, Dr. Arun, coming to your career,
Yes,
you have a vast career uh, since you've been working since 2008. So 12 years, 13th year is going on, right? Speaking of your career itself, what is the training required for being a urologist, and the additional certification that you have to update yourself like
yes.
every once in a while. So what is the training behind that?
Yes, definitely. Because unless and until we update ourselves, this is now becoming a technology-driven science also, healthcare science widely. So there is a constant updation, new devices, new methodologies of treatment are evolving. So my general advice to all the youngsters who want to pursue is, after their general surgical degree. So they, in our country, you need to do a master's in surgery. After that, you need to take over into the urology as an MCH in urology. So after doing your master's in general surgery, advice is to, if you are particularly interested in a particular specialty, say it be urology, neurology, neurosciences, cardiosurgery, so you can work with a particular hospital or with a particular consultant who is already a well-established urologist, so that you start your training then and there. And then once you're preparing for your entrance exams itself, you can have an exposure of the particular field, because this many times helps. Some people think that actually they are interested in doing this particular branch, but once they take it up as a full time, say MCH or a DM, you get, and then you feel that branch is not very good for me. You can't come out and you are wasting a seat also. So it's better to work with somebody who is already there in that field and try to see whether your mindset and you are able to adjust, adapt, and you like the particular field, because passion is one thing which is always going to drive towards excellence. Unless you are passionate about a particular thing, you will never treat or will never try to get yourself updated also. So that is one. The next is, after finishing the MCH urology, usually these days we have a lot of sub specializations. That means you have persons who are specialists in stone, some people who are laparoscopic specialist, robotic specialist, cancer specialist within urology also. So although urology itself is a disease only about the kidney and the urinary tract, still within that we have a lot of subspecializations. The Urological Society of India has started from this year a lot of fellowships which are offered by the USA in 8 subspecialty groups, including what I've mentioned. Apart from that, pediatric urology, andrology, all the subspecialties which is available on the website of the USI, Urological Society of India. So in that website, you have all these subspecialties, which hospitals and which centers offer these subspecialty trainings. And there is also a flexible mode. That is, you can have a 1 month training, 6 month training, or even a 1 year training. And based on the training, they will give you a certificate which can be useful in your clinical practice also. And apart from that, always doing research, writing papers, presenting them at conferences always helps, so that you can be abreast with the knowledge, and also the colleagues and the peers get a good review for your work. So my advice is to basically keep continuing the learning process, and usually it's never age, and no age is actually too old to learn. So you can basically update yourself. People have started learning laparoscopy past 50s and 60s, and they are very successful. So you should not think that I am 40 years old, 45 years old, I can't learn anything new, because you already are a super specialist. So beyond that, it's always going to be a only a small part of your entire subject you are going to learn again. So it's always possible.
So, Dr. Arun, what was your inspiration? What made you decide to be a urologist?
Yes.
And so, what was your inspiration?
Yeah, so I was in the All India Institute of Medical Sciences. I was doing my master's in general surgery, and before joining my master's in general surgery itself, I had decided I wanted to be a cardiac surgeon, because always the medical students are too much in craze with the cardiology. I know that's quite natural, but still, once we started doing our surgical training, we had a posting, specialty postings. So I was posted for 3 months in urology, which happened by chance, because we have a choice of going to either the pediatric surgery department or the urology department. And by luck, I got the urology posting. So by 3 months, when I was in the urology, I saw what all opportunities that the urologist has. As I told in the initial beginning of this discussion, medical management is a important part, and urologist deals with the kidneys. So he is actually a physician also, because many things we can manage with medicines as urologist. And also we are dealing with a very healthy kidneys. So we are actually having the responsibility of protecting the kidney before it fails. So those two things. Plus you are having a lot of endoscopic interventions which many of the surgical branches don't have. For example, if we take gastroenterology, all the endoscopy work is done by the medical gastroenterologist. Surgical gastroenterologist does not do much of the endoscopy except in few places. Whereas in urology, all the endoscopy work is done by the urologist. So we have endoscopic work, we have laparoscopic work, robotic, and also we do transplantation, which is a very complex vascular procedure. And then apart from this, we have a branch called reconstructive urology, which I am very particularly interested in. Treatment of stricture urethra, that is narrowing in the urinary pathways. Sometimes people are born with abnormalities in the urine organs, genitals, all that correction surgeries, reconstruction, like a plastic surgeon, we are also doing. So urology is one branch of the surgical specialty which has the components of all the entire medicine included in it. So because of the wide variety in the field, I chose urology. and I prepared, and finally we were able to take my degree at 2012. So 2009 I started my post graduation in urology, and I finished in 2012.
So, over the years, I'm sure you would have had a lot of interesting cases. If it's okay, would you be able to share some of these cases with?
Yes, see, there are a lot of interesting cases that we encounter every day, including one which we had recently also. There was a lady who was being treated for kidney failure, and she was undergoing repeated dialysis. See, this is not, I'm not telling it as a fault of my fellow colleagues. It's just basically to bring to our notice sometimes that we need to examine the patient also thoroughly. The patient had kidney failure, she is undergoing dialysis, and she was referred for a fistula creation so that dialysis can be done in a proper way. So for the fistula operation, I asked her to meet my vascular colleague. She just asked me for an opinion who does the fistula very well in the city. So I suggested my vascular friend. So when he did the procedure, they just put a catheter for her. And the moment the bladder was catheterized, she started passing a lot of urine. Her kidney failure suddenly vanished. So basically, the problem was obstruction. There was a block in the urinary pathway, which nobody had taken a note of, or nobody cared to treat, and they were just doing dialysis for the patient. And after this catheterization, he said, you have to look at it again. So that was the first time I met her actually. So when I saw the patient, I saw that the bladder was very shrunken. She seemed to have a tuberculosis condition of the genital urinary tract. So tuberculosis in our country is also quite common, even occurs in the kidneys. But advantage is, once you treat it with good quantity of medicines for a duration of say 9 months to 1 year, they get very much improved. And when I saw the patient, she had one kidney destroyed, the other kidney was obstructed. So we did a reconstructive operation on her, and touch wood, now she is 7 years post the surgery. Her kidney function is stable. She doesn't require any dialysis. She is living an entirely new life, which she herself never expected, because she had resigned herself to dialysis and probably eventuality at that point of time. So this seems like a miracle when you see these patients recover. So this is one of the very some of the heart touching case which I can actually tell you. There are plenty more anyway, but I don't think time will be there. Yeah.
So, tomorrow is World Kidney Day. So, I wanted to know how would you be planning to? We both, Soumya and I, we both wanted to know how you would be planning to celebrate World Kidney Day, and what is the message you would like to give as far as the doctors, tomorrow's urologists, kidney specialists, and so on. What is the message you'd like to give them?
Yes. So, World Kidney Day, we are planning a small celebration at our hospital, also at the clinic also. So we are just going to invite all our consultants in the department. At the same time, a chief guest or a special invitee is planned to come, and we will have a small talk on kidney awareness. Nephrologist as well as the urologist will be participating in it, and some of our old patients whom we have done transplant procedures or some major urological procedures, they will come forward and give testimonials. Basically, this is to boost the confidence in the medical system, and always the word of mouth is one. The next is, whenever the patient himself talks about a particular problem being handled by the doctor and the hospital, the credibility of information is very high, rather than me going and telling everywhere that I can do this operation, that operation. A single patient tells that yes, I went there with these problems and I become all right. It speaks volumes. So we are planning it in that fashion, and then we will have also a small informal get together of our doctors at the clinic too. And I have actually posted our awareness messages on the clinic Facebook page also. So probably I think I'll share them with you. And my tips would be, generally for kidney health, is to drink adequate amount of fluid, at least 2 liters per day. Control your blood pressure, control your diabetes, do adequate exercise, stay fit, and eat healthy. Avoid taking medications over the counter from the nearby pharmacist or chemist without prescription and without reason. So many painkillers, antibiotics are not good for your kidney. And also, if the habits that we have generally, smoking or drinking, we can give them up. It's always the betterment for us as well as for the kidney health too. So these are the general tips for the healthy kidneys in for the public. And all the young urologists, they should all take a pledge that we should not allow patients, especially patients with healthy kidneys and developing a renal failure because of a stone or some tuberculosis or some treatable condition to progress. So we must give them timely treatment. Correct diagnosis, proper examination goes a long way in building patient confidence and also getting a correct treatment, because many times we don't examine the patients, we are in the dark. And these days COVID has actually made us stay more away from the patients. Although they are coming to the consultations, we have a big shield in front of us, a big sort of a prevention going on, so you don't allow not more than one person in, and then you don't examine when there is absolutely no need. So all those things actually reduce the bond between the patient and doctor. More and more patients should be touched by the doctors physically, examined. So that gives the confidence. So never young patient, young doctors should always keep that in mind. Clinical examination, thorough examination of patient will give you the diagnosis. Even sometimes the tests may not be very accurate or they may be confusing, but only the history and examination will make you take the right decisions. So always keep that in mind.
Doctor, I have a question.
Yeah.
Uh, it's regarding kidney failure.
Yes.
Uh, Maybe elderly person, maybe acute diabetic person. How do you manage like in those conditions? Like how do you treat those kind of patients?
See, diabetes causing renal failure, there can be many reasons. One, it can be a effect of the kidneys per se because of the diabetes causing damage to the capillaries or small blood vessels in the kidney. So because of the diabetes, the small blood vessels in kidney become very thick. They are not able to function well. So we call it as diabetic nephropathy. And they leak all the protein in the urine, and the kidney tissues gradually get affected by the high sugar levels. So this is something which leads to ultimately chronic kidney disease or CKD, and they may need dialysis and other treatments. On the other hand, there are a lot of diabetic patients with acute kidney problems, say kidney infection, kidney abscess, or sometimes in diabetes you get diabetic ulcers in the kidney, and sometimes tissue bits may block the kidney tube. So all those things may cause pain, fever, vomiting, low urine output, and sometimes because of that you may actually patient may be in a septicemia, or the blood may have an infection because of the infection spreading from the kidneys into the bloodstream. So good amount of antibiotics, and also ensure that the urine flows out from the kidney without any obstruction. Sometimes we put a small tube into the kidney called a stent, or sometimes an external tube is put into the kidney. So all this is to drain the kidney's urine. So in diabetes, as we see, the stone disease is also very common currently. So that is also a reversible cause of kidney failure. So diabetics have more reasons to have kidney problems than others, and many times these kidney problems can be restored to normalcy. That is the main idea. So once you have a diabetic patient and some creatinine is little high, doctor should not think it is because of the diabetes and keep treating him with medicine, medicine, medicine. Try to evaluate and see if there is any treatable cause, say an infection or a stone or some block in the kidney which can be corrected. So once that is corrected, his creatinine will come to normal. So the patient should not be just like that. As I told just previously, that examination history, we can be able to differentiate all these things. So that's the thing. And controlling the sugars is the most essential part, because urologists are mostly not involved in the sugar management. We go, we see the kidney, we treat the creatinine and the urinary obstruction. But ultimately, if the sugars aren't controlled, he's going to land up with you again and again with the same problem. So, strict control of sugar. And once you have mild renal failure, insulin may be needed. Tablets may not be sufficient for the diabetes also. But that decision usually the diabetologist takes, or the physician who treats the patient usually considers.
Thank you, doctor. And last question, doctor, just regarding the water intake. See,
Yes,
normal people say like you have to drink 4 bottles of water, 5 bottles of water, 8 bottles of water for
yes,
proper
yes,
kidney health. So,
yes.
as a doctor, like how much amount of water do you recommend for a person to drink like in a day?
In a day, we need to take around 2 liters of water for a normal handling of our body wastes. Additionally, suppose is a person who works a lot of outdoors or he does strenuous labor, manual labor, then he may increase his intake up to 3 liters per day. The rough guide is 50 ml for every kg of the body weight. Suppose it's a 50 kg person, he needs to take 2.5 liters. 60 kg, 3 liters. 80 kg, sometimes 4 liters. But beyond 4 liters, consumption is usually not warranted, because our kidney itself is a wonderful organ. It actually, if you see, it filters the blood many times in a day. Actually, the urine production per day should be 180 liters. That's the normal way the metabolism works. But the kidneys reabsorb 168.5 of it. That means only 178.5, sorry. So only 1.5 liter of urine is actually being produced by the kidney. So it's able to recycle the water at best. So we need to be sure that we are taking enough to keep it functioning well. 2 liters will be the lower end, and beyond 3 and 4 liters depending on the circumstances, but never beyond 4 liters. 4 liters means we have 4 bottles, or and on a small scale, sometimes in patients who are having cardiac problem, liver problem, we may sometimes reduce the fluid intake also. Yeah, that's the bottle you are showing me is around a liter. So we need to consume maximum 2, if necessary 3, and sometimes very obese or patients who have a lot of sweating and they do a lot of workouts or on a manual labor, they may, in summer months, sometimes you may go up to 4. And the thirst is a very useful guide. If you are very thirsty, you can always drink water. And the idea is to keep urine dilute, say maybe transparent or a pale yellow color. So if that's the color of urine you are getting, that means your hydration is adequate.
Yes, I was coming to the color of urine actually.
Yes.
There have been cases, or maybe like I feel like if I have antibiotics, the color of the urine will be like more than yellow.
Correct.
If I am not taking any tablets or any sort of multivitamins or any medicines, the color of the urine will be mild yellow, and sometimes I'll feel colorless. So when as a person should be worried, about the urine color?
Urine color changes with whatever medicines we take, because all the medicines will have some coloring agents also. So the, and also even naturally occurring substances, like if you take beetroot, your urine becomes a little reddish also. So these are all physiologic variations. Concentrated urine becomes darker in color. It's light, darker yellow, sometimes even light brown. It's very concentrated. But the thing is, we need to keep the normal urination color is transparent. That is, we call it white, or white is actually not the word. It should be transparent and light yellow. Otherwise, anything beyond that, always try to see if you can take more water to keep it dilute. Any blood in urine or red colored urine is an alarm, or sometimes patients get a dark brown urine. The dark brown urine means there is a bleeding which has already occurred in the urinary tract, and later on the clots are coming out. So any color in this range, dark brown, red, immediately seek the medical attention. Otherwise, you can always observe and see with your fluid intake whether the color changes or not.
So, doctors, regarding that, what is your opinion? And I am asking this for myself as well as a lot of people out there. What is your opinion for detoxing? Because we are told, like I on a personal level, so people keep telling me you have cucumber water, or you have lemon water, or apple cider vinegar. And so what is your opinion on all these when it comes to your kidneys and your urine and all? So that's why.
See, most of these substances are part of what we call as inner cleansing and all. So you take a lot of these antioxidant substances to reduce all the oxidative stress, waste in your body. So kidneys generally, they are able to manage all these things. So it doesn't matter. You can consume them. It's not a problem. Only thing is, the effect that they cause on the urine is basically they make it little more alkaline. So sometimes in patients with a lot of urine infections and all, we don't advise them to get their urine too alkaline. So they may start drinking a lot of these citrus juices, and ultimately make the urine too alkaline. So lemon, for example, excess of it sometimes can produce stones. Excess of the lemon thing may produce a more alkaline urine, which may actually be harmful to you. May infections may increase. All things should stay within a what we call in Tamil we have if you exceed a particular particular limit, even nectar becomes a poison. So something like that. Okay. So everything has a limit. You cannot consume it daily. You can probably do it over the weekend or maybe a 2 or 3 days a week. But taking them doesn't usually cause harm in the right proportions. So kidneys are organs which have got a lot of energy. They can repair, regenerate themselves, no matter whatever rubbish you throw at them. So they will actually try to become normal and save you. So we have to draw the line, not take in too much stuff so that it becomes too badly damaged.
One final question: how would
Yeah.
you approach a case um, when there's a child involved, as compared to when there's an adult? When there are children, usually children with kidney problems is not that common, I've heard, but
Yes. See, children with urinary problems, most of them are birth-related problems. Many times they are diagnosed when the child is in the mother's womb, and on the after delivery they come for a follow-up. Or many times the problem itself gets picked up after the child is born with, say, urinary infections. Sometimes there are visible urine abnormalities. So whenever a child is involved, there is a lot more anxiety attached to it because both parents are very anxious, and sometimes there is also a problem going on as to how it arose. Why did it come? So did the mother take anything during the pregnancy, or sometimes is uh, the child having other medical problems or other abnormalities in other organ systems? So all these problems has to be addressed. So the pediatric doctor plays a very unifying all these specialists, because he will get the opinion of the cardiac doctor if needed and the urologist. So having a good rapport among the pediatric doctors, so that they are the primary point of care for the child, because child goes to the doctor for vaccination, usual cold treatment, everything. The pediatrician is the center point. So as a urologist specialist, we must have the pediatrician along with us, inform him every step that we are going to take. And most of these days we are doing a lot of consults which are taken through the video. Also video consent, we record our consents. So in children especially, recording consents are mandatory. Why? Because child doesn't give consent for anything. He's not legally having any standing in that. So the parents have to give a consent, and many times we take consent of both the parents, because what happens, there is an internal conflict. Sometimes mother says we do the procedure, father and their family are against the procedure. So we cannot have different opinions and then proceed. So generally we do the consent, especially in children. Recorded consent is taken. Both mother, father should be there, and sometimes both of them are available in the hospital also all the time. The child is undergoing the treatment, and even treating them post-operatively, everything, even a small symptom is very sensitive. So child feels any little pain, the anxiety level is too high. So we should also involve the anesthetic doctors to make sure the child stay in the hospital becomes very smooth and pain free, especially when we do any surgical procedures.
Soumya, do you have any questions?
I know as of now it's done, but there are so many questions, and maybe
Yeah.
if I ask that I'll take, because the thing is that I remember people telling me, Soumya, stop the intake of tomatoes more. You'll will be prone more to kidney
Kidney
stone and all.
stones.
I stopped eating tomatoes look in a higher end. So there are so many things in my mind right now, but thank you
And,
so much, Doc. We
yes,
have
I
taken.
Thank you
understand.
so much, doctor.
Diet is a very major part of everybody's life, and many diseases are diet related also. So generally, one point, if you want, just must make the stone disease. Whenever it occurs, it doesn't occur just because you are taking this food or avoiding this food. It's mostly a innate abnormality in the kidney when it's filtering the urine. So completely avoiding any food stuff doesn't cure the problem. So as you said, avoiding tomatoes, cabbage, lady's finger, brinjal and all completely doesn't mean that you are not going to get stones. But if you avoid them completely, you may lose out on some of the nutrients or good things that it contains. So many times they tell you don't take green leafy vegetables if you have stone. But green leafy vegetables are a rich source of vitamins A, K, and fiber. So just by avoiding that, you are not going to prevent your stone, but you can actually include it maybe once or twice a day. So always have a measured eating, include all the fruits, vegetables judiciously in your diet, and try to see if you can have a different menu every day rather than eating the same thing repeatedly just because you like it. So everything has its own goods, and excess will create a problem. But as long as you don't take it in excess, all the good components in the particular food or the vegetable will be with your body.
Thank you so much, Dr. Arun, for being here today with
Thank you.
us. Once again, thanks once again.
Dr.